Nurse, are you lost? Or just incompetent? The voice of Dr. Marcus Thorne was like a scalpel, sharp and cold. It cut through the organized chaos of the trauma bay, and the entire team froze. Nurse Anna Hayes, on her third day, fumbled with a sterile pack. Her hands, slick with nervous sweat inside her gloves, caused the pack to slip and hit the floor. Dr. Thorne, the hospital's god of surgery, looked at her with pure disgust. "This isn't nursing school," he hissed, his voice low and dangerous. "We're trying to save a life. You're a pair of hands, nothing more. If you can't even open a pack, you have no business being in my bay. Get out." Anna's face burned, a painful, bright red that stung her eyes. "Dr. Thorne, I'm sorry, Get out," he repeated. "Go restock a supply closet. Do something you're actually qualified for. I'll have a real nurse in here." Tears pricked her eyes as she backed out of the room, the doors swinging shut behind her. The other nurses and doctors quickly looked away, too scared to defend her, too relieved it wasn't them. Anna fled to the supply room, her body shaking. She had worked for 5 years, saved for 3, and clawed her way through nursing school to get here. She knew she was smart. She knew she was a good nurse. But in the eyes of Dr. Thorne, she was nothing. 2 hours later, she had herself under control. She was assigned to float, meaning she just helped where she was needed. Her confidence was shattered. She spent the time quietly cleaning, restocking, and avoiding Dr. Thorne. Then, the new ambulance call came in. Multiple GSWs. 2 patients critical, the radio blared. The emergency room exploded into action. Dr. Thorne was back, calling for his bay, Trauma 1. The second patient was wheeled into Trauma 2, right where Anna was stocking gloves. "He's all yours," the lead doctor shouted, running to help Thorne. "This one is stable for now. Just keep him that way." Suddenly, Anna was left with a senior nurse, a resident, and an unconscious man. "Okay, Hayes, you're with me," the senior nurse, a kind woman named Maria, said gently. "Let's get this man assessed." The patient was in bad shape. He had been shot in the shoulder, and the bullet had exited his back. He was bleeding, but it was under control. He was unconscious, pale, and cold. "He's a John Doe," the resident said, working fast. "No ID, no family. Paramedics just brought him in. Let's get a line in, push fluids, and get him prepped for surgery." Anna went to work. This was what she was trained for. Her hands were steady now. As the resident called out orders, she began cleaning the patient's arm to insert 4. The man was covered in dirt and something else. As she wiped his forearm with an alcohol swab, she saw it. It wasn't a rash. It wasn't a bruise. It was a tattoo, but not a normal one. It was a simple, small, black medical symbol, a star of life. And underneath it, in tiny, faded script, was one word, dantrolene. Anna's blood ran cold. She had seen that word once before in a textbook in a chapter most people skipped. It was an obscure medical term. "Maria," Anna said, her voice quiet. "Can you look at this?" Maria leaned in. "A tattoo? Nice, but let's get the 4 in." "No, the word," Anna insisted. "Dantrolene. Doesn't that mean—" Before she could finish, the doors to the trauma bay burst open. Dr. Thorne strode in, his face like a thundercloud. "My patient just expired on the table," he snapped. "This one is mine now. What's his status?" The resident immediately jumped. "John Doe, sir. GSW to the shoulder, stable, prepping for, or—" "I'll be the judge of that," Thorne said. He grabbed the chart. "He's lost a lot of blood. He's cold. We need to get him warm and get him a surgery." "Nurse." He pointed at Anna, not even using her name. "Get the warming blanket. And you," he said to the resident, "we need to intubate and get him under anesthesia. Now." The team jumped. The anesthesiologist, Dr. Lee, began prepping his tray. "What are we giving him?" Dr. Lee asked. "Standard procedure," Thorne said, not looking up from the chart. "Let's start with succinylcholine to paralyze. Then we'll intubate and put him on gas." "No." The word was out of Anna's mouth before she could stop it. It was a shout. The entire room froze. Again, Dr. Thorne turned, his eyes narrowing into slits. His face, which was angry before, was now something far more terrifying. It was calm. "Excuse me, nurse," he said, his voice dangerously soft. Anna was shaking from head to toe. She could be fired. She will be fired. But she looked at the patient and then back at the doctor. "You can't," she said, her voice shaking. "You can't give him succinylcholine. Dr." Thorne walked slowly toward her until he was just inches from her face. "And why?" he whispered. "Can you possibly tell me that?" "The tattoo," Anna said, pointing to the man's arm. "It says dantrolene. It's the only drug you can use to treat malignant hyperthermia." Dr. Lee, the anesthesiologist, froze. His hand was hovering over the syringe. Thorne glanced at the tattoo and scoffed. "A tattoo? You're stopping a life-saving procedure because of a tattoo?" He could have lost a bet. It could be his girlfriend's name. "Get out of the way, Hayes." "No, sir," Anna said, her voice finally strong. "Malignant hyperthermia is a rare genetic disorder. It's a deadly reaction to common anesthesia. Specifically," she locked eyes with Dr. Lee, "succinylcholine and anesthetic gases. If you give him that, his muscles will seize, his temperature will skyrocket, and he will die. On this table, it's a 1 in a million chance, but that tattoo, it's a warning." Dr. Thorne was bright red. "Are you a doctor, Hayes? Did you go to medical school?" "No. You are a nurse. You will follow my orders, or I will have you physically removed and your license revoked." "Then do it," Anna said, her voice breaking. "But I won't move." She had planted herself between the doctor and the patient. It was career suicide. "Sir," Dr. Lee said, his voice hesitant. She might be right. It's rare, but it's possible. If he has MH, those drugs will kill him instantly. He'll die anyway if we don't get him to surgery." Thorne roared. "Now move." "What's the alternative?" Maria, the senior nurse, asked quietly, looking at Anna. Anna took a deep breath. "You can't use sucks. You have to use a different paralytic, rocuronium, and you can't use gas. You have to use Ativa, a total intravenous anesthesia. It's the only way he'll survive the surgery if he has MH." "That's a what if?" Thorne shouted. "His injury is real. It's not a what if." Anna shouted back, her fear finally replaced by pure, hot certainty. Why would anyone get the name of an emergency reversal drug tattooed on their arm? He's a John Doe. We have no history, no family. This tattoo is his history. It's the only voice he has. Please, just listen to it." The bay was dead silent. The only sound was the beep of the heart monitor. Dr. Thorne stared at Anna. He was a man who had never been questioned, never been wrong. He was the god of this hospital. And a new nurse, a girl he had humiliated just hours before, was telling him he was about to kill a man. He looked at the tattoo. He looked at the syringe in Dr. Lee's hand. He looked at the patient. With a growl, he threw the patient's chart across the room. "Fine," he yelled. "Fine. You want to play doctor, Hayes? You just bet your entire career on a piece of ink. Do it your way, Lee. Tiva, rocuronium. But if he crashes, it's her license." He pointed a finger at Anna. "And you're scrubbing in. You will stand right next to me, and you will watch. And if this man dies, you will know that it was your fault." An hour later, they were in the OR. The room was tense. Anna's heart was pounding so hard she thought it would break her ribs. Dr. Thorne was a master. He worked with speed and precision. But he said nothing. He just barked orders. Suction. Sponge. Clamp. The surgery was complex. The bullet had missed the main artery by millimeters. Then, the patient's temperature, displayed on the monitor, started to creep up. "Temp is rising," a nurse said. "See Hayes." Thorne muttered under his mask. "He's getting hot. He's going septic." "No," Anna said, watching the monitor. "Look at his EKG. It's irregular. And his CO2, it's climbing. It's not infection. Sir, it's happening, even without the gas. The stress of the surgery is triggering it." Dr. Thorne looked up. Anna was right. The man was going into malignant hyperthermia. Right there on the table. He's going to die, the resident whispered, his face pale. No, he's not, Anna said. She turned to Maria. Get the MH card. Now, Dr. Thorne, Anna said, her voice now the loudest and clearest in the room. I need 20 vials of dantrolene. Now. Thorne was frozen. He was watching a nightmare unfold. Doctor, Anna shouted, and for the first time it was an order. Get the dantrolene. Stop this surgery. We have to cool him. Anna's voice snapped him out of it. He was a surgeon, but he was also a doctor. Do it, he yelled. Get the ice. Cooling blanket now. Give me that drug. For the next 30 minutes, it was a different kind of war. It wasn't surgery. It was a rescue. Anna was at the center, calling out doses, directing the team to pack the patient in ice, helping Dr. Lee manage the man's failing heart. She moved with a confidence that no one in that room had ever seen. And Dr. Thorne, he became an assistant. He was mixing the dantrolene. He was holding the ice. He was taking orders from a new nurse he had tried to fire. Finally, the temperature started to drop. The heart rhythm stabilized. The CO2 levels went down. The patient was breathing. He was alive. The room was silent, except for the beeping of the monitor. The team was exhausted, covered in sweat and sterile water. Dr. Thorne stood up. He looked at the patient. Then he looked at Anna. He slowly, deliberately pulled off his surgical mask. He walked over to her. Anna tensed, expecting him to yell. Instead, he just stood there, looking at her. The arrogance was gone. His eyes, they just looked tired. Nurse Hayes, he said, his voice rough. Yes, doctor. He didn't speak for a long moment. Then he cleared his throat. You will meet me in the conference room in 10 minutes, and you will bring a copy of this patient's chart. He turned and left the OR. Anna walked into the conference room. Her legs felt like jelly. Dr. Thorne was there, along with the hospital's chief of staff. This is it, Anna thought. He's going to fire me for insubordination. Nurse Hayes, the chief of staff, began, her face serious. Dr. Thorne has just told me what happened in the OR. He has also told me what happened this morning in the trauma bay. Anna's eyes dropped to the floor. Yes, ma'am. Dr. Thorne, the chief of staff said, has submitted a formal request. Do you know what it is? No, ma'am. He has requested that you be permanently assigned to his surgical team as his primary scrub nurse. Anna's head snapped up. She looked at Dr. Thorne. He was not looking at her. He was looking at the table. Dr. Thorne, he said, his voice quiet, is an arrogant fool. I'm an arrogant fool. This morning, I humiliated a colleague. And this afternoon, that same colleague saved my patient, my career, and me. I told her she was a pair of hands. I was wrong. She was the brain. He finally looked at Anna. For the first time, she saw the man, not the god. Anna, he said, using her first name. I apologize. What you did today, it wasn't just good nursing. It was the best doctoring I have ever seen. I was so focused on the bullet, I missed the thing that would have actually killed him. I was looking, but you were seeing. He stood up. I will never overlook a nurse again. And I will never, ever go into a difficult surgery without you, if you'll have me. Anna looked at the two most powerful people in the hospital. She had come in that day as a terrified new nurse. She was walking out as a lifesaver. She nodded, a small, proud smile forming. I'd be honored, doctor. Before you go, smash that like button, share this with someone who needs to see it, and tell me your biggest takeaway in the comments. Subscribe for more content like this. Thanks for being here, and I'll see you in the next video.